Hello, everyone. So I'm going to tell you something that I was complaining in the back because everyone except Dave Rue should stop on Access. So thanks to Sally, event manager, just told me you can do anything you want except dancing. So thanks for coming and thanks for giving us the opportunity to be here. I am the last one, I promise. It's not going to take long, about 45 to 50 minutes, if you're okay with that. If you didn't get your translators for accents, there are some tools in the back. You can get it. So everyone is okay with that. And I need more applause here because I'm kind of nervous. So actually, I was lying, but it felt good. Thank you. This is me. 2015, at the end of Boulder Ironman. I am the founder and CEO of Cliexa. Nothing to do with an Ironman race, but it's time for me to show off, so let me do it. So it is one of the most unbearable times, like probably 13 to 14 hours of my life. Like, oh my God, super painful. I cannot even bear the pain anymore. But there's one thing that kind of triggered everything for me. It was like, I know there's a finish line. Whatever is going to happen, I have volunteers, water, Advil, everything that I need. I know I'm dying. The total distance is 140.6 miles. Just to let you know, like, the first time I learned swimming was 3 years before that. But dedication, check. Dave Rue said, right? Ambition, check. Crazy, my wife calls me, check. Everything I have. That finish line, that dedication just got me to the end of the race, and I was an Ironman in 2015. That was my first, and I want to keep doing it more. But I'm not here today about me. This is healthcare. I'm here because of 117 million people in the United States, like Nancy here, with chronic pain. For me, I can have a finish line. That pain is going to go away. For Nancy, who is one of 117 million people who has rheumatoid arthritis, for those who doesn't know about it, it is caused by your autoimmune disorder on your joints, 28 joints in your body. And then you manage about 5,000 hours in a year to handle that non-stop pain. And let me remind you, no finish line. She's using heavy medication, injections, that causes like nausea, blindness. And I'm not exaggerating. Until I started to work with one of my partners, I had no idea. That's the only pill that stops the pain for her, for a little bit. Imagine an Ironman race, non-stop. Thank you for life. She sees her doctor like once in 2 to 6 months. Once in 2 to 6 months, and now she needs to tell what happened in past 2 to 6 months. And then if she cannot manage the pain, if she tries to call the doctor, earliest she's going to get there in 3 weeks. Where does she end up? Emergency room, right? This is Robert, the rheumatologist. He wants to help so bad, like one of those volunteers in the Ironman race to give you the water. The problem is, Robert has 15 to 18 minutes to listen to Nancy, understand what the pain is coming from. I don't even remember what I ate last week. Optimize the medication, write everything into electronic medical records, finish it off. He's not done yet. There's another 20 patients that he's going to see. That's incredible painful, not only for Nancy, but also for Robert. What can you do to kind of close that feedback loop, but also give an opportunity for Nancy to talk to her doctor real time? That's when we come up with Cliexa mobile platform. To close that feedback loop, to give the opportunity to Nancy to report the symptoms, complications, medications real time, which will go to Robert. He doesn't need to see Nancy in the next 2 months, like regular scheduled visits, but then respond on time with clinical alerts if there's a flare that they can see and call the Nancy back. I'll show you how it works. It's super simple. Mobile platform right there. This is a free app any patient can install right now. All Nancy can do is just touch the screen. You can see the tender or swollen or both symptoms can be reported on the screen by just touching the screen anytime the symptom occurs, any joints. As Nancy does it, we generate a disease activity score. That is what Robert knows, how he can respond to that right away. Here's the medication screen. We sync with FDA database every 3 minutes for approved drug database. Also, we can get that data for an EMR system, what is prescribed. You can put as a patient your frequency of the dosage, which you can get notified. You can add your complications, and now there comes the real data right over there for the doctor. In 5 seconds, without seeing Nancy, Robert can look on the screen, on the EMR screen, get an alert, and decide what has been going on in about 6 months. Now, I saved 10 minutes on that visit already when Nancy is going to see the doctor. This is incredibly simple, but yet solves a big and comprehensive problem for clinician and chronic disease patients. Now, I'm talking about rheumatoid arthritis here, right? So Nancy, with this application, can avoid emergency visits because she just got a call from Robert to say, change your dose to something else. I can see the flare. Now we avoided the emergency visit. Robert is going to be actually helping more patients in short amount of time, and obviously, he's going to be a more responsive physician with the data in front of that. And providers, hospitals, insurance companies, you have chronic care analytics in front of you, live, preventive and responsive treatments. What happens? Cost savings. I'm not going to talk about that because we have a lot of people in healthcare here. This is not new. There is a research database that you can search that patient-reported outcomes in any platform or any way, any model can save 30 to 60% of the cost for chronic care. A lot of papers. It could take me probably a year to talk each of them. So I am talking about something that has already been clinically validated and done. So $2 trillion is spent to manage that for all these patients with one or more chronic disease conditions. So let's look at the numbers, cost savings, right? Very simple. Return of investment. So Nancy, without counting any joint replacements, surgeries, any complications, cost about $23,000 a year. Regular treatment. We charge $600 with annual subscription with the mobile data collection, chronic care analytics, EMR integration, data feed. That's $600 per year, which is already like about 25% of that cost. 25, even 0.25. Now, if we were to save 10%, forget about the 30 and 60%. If we were to save 10%, that will be $2,300 per year. Now, if I'm coming from Colorado, if you're actually managing 5,000 of rheumatoid arthritis patients, you'll be saving $11.5 million. Real numbers. Now, this is just RA, and then this is what the projections would look like if we would manage about 100,000 patients, 2021. Well, do you know how many rheumatoid arthritis patients in the United States? I'll tell you, 1.5 million of them, just rheumatoid arthritis. I didn't even talk about other diseases we're managing. I'm just going to give you a little snippet of it on traction slide over here. Well, let's talk about NIH. February 2017, an article came out, which was a surprise to me. There were about 936 rheumatoid arthritis apps in the stores. I had no idea until I just did a SEO research on the site, landed on this article. This article tested 936 of them. They selected 19 apps out of 936. And trust me, I didn't pay any of these guys to do anything. There was only one app. If any of you can guess which app that is, why are you laughing? It's a serious business here. There was only one app with the disease activity scores, data tracking tools, remote patient care team engagement. Articles over there. Out of 19 apps, Cliexa was the only one with all these features that were listed. So let's talk about what we did very quickly. There's a lot of it. I started this journey with the team of awesome people. One of them actually is here, one of the believers. David was saying, those people who actually take the, what did he say? Collateral damage with you, with the entrepreneurs. These people have been doing that with me. I'm going to talk about that, but last year when I started this journey with all of them, we got 2 apps already in the stores. We got an FDA clearance last year on 2016. FDA, pain, I think you can connect those 2 things. We got clearance for our decision support mechanism for predictive analytics in the back end. We finished the accelerated program from Boomtown. That's how I know the CEO of Ventural here, Mike Sobol. And then by the end of August, we engaged with Kaiser Permanente. We started a rheumatoid arthritis clinic project with real-time patients, real rheumatologists. They believed and partnered with us with Colorado Permanente Medical Group since November 2016. They've been helping us to build better, more improved, and well-rehearsed project, a platform that can help many other disease states. But rheumatology was the journey we started with them. And by the end of January 2017, we raised our seed fund. We ended up generating 2 more disease states apps, which is GI, gastroenterology for IBD, inflammatory bowel diseases, and then chronic obstructive pulmonary disease. As you know here, we started with Ventural, which actually took another journey with us over here, and then it is incredibly well being here. I'm not going to repeat the same things, but I'm going to talk about a little bit at the end. What we're going to do is we're going to continue our 3 official pilots already happening, Rush University, Kaiser Permanente, Colorado Permanente Medical Group in Colorado since November 2016, Colorado Arthritis Center. We're testing the same thing on the mobile digitized platform in the clinics with the patients. We're going to release a case study by the end of next month. But here's what this whole Maine visit actually paid off here. We engaged with amazing Maine health representatives, clinicians, business officials. I mean, I can name, there are 40, 50 people over here, but there are some of them that have been incredibly, amazingly helpful. From the management all the way to here. I don't want to give all the names, but Julie Trimmer, Missy Cormier, these people are the ones I started with. Joel Worth, Jennifer Ma, I can talk all day. Unum, great help. I didn't put their logo because it's similar to mine. I don't want to copy that. I don't want that. We're going to finish our case studies, publish it. We have over 5,000 users with no marketing in app stores already. These are the rheumatoid arthritis patients that are downloading and using the app. We have a system we track how many of them are already actively using it. And then November 2017, we're actually hitting congestive heart failure and then cliexa-RA for asthma. Now, I talked about rheumatoid arthritis, right? Now, we're going to hit the 117 million people market after this right away. So, collateral damage, the folks that started with me, unfortunately, they have been listening to this accent for almost more than 2 years now. I'm coming from a background of software technology. I worked in pretty much director VP level positions, starting with iTriage. I left Aetna last year when I started this journey in May. My wife thinks it's still the best thing that I have ever done. Pretty much the people I work with, my co-founders, my beautiful wife, my son, everyone in Maine Health, Unum, Venture Hall proved me that I'm taking the right journey. With the 3 doctors we started, guess who are? Rheumatologist, gastroenterologist, and now the immunologist. Then We have Haluk, who's here with me on the business side, worked for years in Motorola. Nate, we worked on software technology for years. Lance in healthcare operations, administration, and then great CMO, developer, and then Katie Richardson, who has been helping amazingly from Kaiser Permanente Discovery Innovation Group with Colorado Permanente Medical Group as well. And Ted Pincus, Dr. Pincus is the inventor of 2 commercial models exist globally for rheumatoid arthritis modeling. He is actually one of my board of advisors. I'm really thankful working with an amazing team. I think success comes from any of these people that I just talked about, and sorry that I couldn't name any other people over here. Now, we're not disrupting the technology. I'm going to use that buzzword here. We're trying to give people like Nancy a great quality of life by closing that feedback loop between their clinicians and their caretakers. This can be care teams, nurses. You know what we're talking about. Patient-reported outcomes transmitted. Now, there's nothing for me. I am not a crack, like Dave said. My wife thinks the other way. But making something better for chronic disease patients who never see that finish line like I did is the best thing I've ever done in my life. And I'm really thankful for the community and Maine Health and Maine people here. Incredible, incredible opportunity. Thanks to VentureAll getting us over here. And thanks for listening to me. And thank you so much for being here for anyone from these organizations for any type of support. Thank you.